So my name's Liz Sampson. I'm the Deputy Head of the Marie Curie Palliative Care Research Department, and my official title is Clinical Reader in the Marie Curie Department at the Division of Psychiatry. And what that means is that I'm a clinician and an academic. So I spend 4 days a week doing research here in the Marie Curie unit, and then I spend 1 day a week working in a very busy acute hospital, and that's called North Middlesex University Hospital. That's in North London. So the main aim of my research is to improve end-of-life and palliative care for people with dementia, frailty, and people who may have other neurodegenerative diseases like Parkinson's or motor neurone disease. But we really focus on people with dementia because it's such a huge population. And I lead a team of researchers and research fellows, and we look at various aspects of the ways that we can improve care. So we've got 3 main strands to our research. The first is about understanding symptoms and problems that people with dementia may have as they're reaching the end of life. So we've done quite a lot of work about pain and agitation and the care received by people in care homes. Then the second main strand of our work is to do with carers, and that's led by Dr. Kirsten Moore, and we do research on improving the experience of carers, so both before the person with dementia has died and after the person with dementia has died. And then the third aspect of our work is to bring all of that work together and to think of ways that we can improve care. So we develop interventions that can be tested and worked through in care homes, acute hospitals, or now with people in the community. And that's really looking at direct ways that we can improve care for people. It's really important because dementia is now the commonest cause of death, and unfortunately 1 in 3 of us is likely to die with some form of dementia. And that means that all of us will have a family member or a neighbour or a friend, someone that we know, who will die with dementia. And when people die with dementia, it can be different from dying with other illnesses. So they may lose the ability to maintain their relationships, they may lose the ability to make decisions for themselves. It's a very different set of circumstances, and so far care hasn't been tailored towards them and their needs. So it's really important for all of us that we improve care that people with dementia receive. We've had various impacts over the years. If I choose one example, we were able to do what's called a Cochrane review, where we looked at all the evidence for artificial tube feeding and hydration, so artificial feeding in people with dementia through tubes. And we were able to review all of the evidence on that, and we found that there was no evidence that feeding people artificially when they can't eat or swallow for themselves prolongs their life or improves their quality of life. That was a really important finding, and that's now been incorporated and used to produce guidance by the National Institute of Clinical Excellence, and so now that guidance is available for health, social care professionals, carers to look at all over the world really. So that's been a small piece of work that we did, but that's had a great deal of impact on care. Another area where we've had a lot of impact is studying people with dementia who are admitted to acute hospitals. They're often towards the end of their lives. They have a very difficult time when they're in hospital. It's a very busy, noisy, difficult environment for them, and we have done a series of studies on people with dementia in acute hospitals where we've looked at how common their problems are, we've looked at how common pain is, how staff respond and meet the needs of the person with dementia, and that's fed through into a number of policies and has led, I think, to a much wider acknowledgement of the issues of dementia in acute hospitals and improvements in care. So if I think about our future in research, what we've done recently is to try and bring all of our research together, and we've been very fortunate, and we've just been awarded a major programme grant, and that's a very large grant that now enables us to fund work over the next 5 years. And that programme grant is funded by the Economic and Social Research Council and the National Institute for Health Research, the ESRC and the NIHR. And in that programme we will really have some quite ambitious aims. and that's to produce what we term a step change in care for people who are dying with dementia. And we'll be looking at public surveys, trying to shift public opinion. We'll be looking at current data and numbers of people with dementia and what their needs are. We'll then be projecting the future needs of the population so that policymakers can plan. We'll be looking at the needs of carers and then devising new ways to care for people with dementia towards the end of life. And that's a really exciting project. It brings lots of new staff to our department, and it's enabled us to collaborate with the Cicely Saunders Institute at King's College. So really brought together two leading UK research institutions, and I'm really excited to be working on that grant and leading that grant, and that's going to be really the main piece of work that I'm going to be focusing on over the next 5 years. I'd really like to thank Marie Curie because 10 years ago, before many other organisations, they recognised that many more people would be dying from dementia, and they funded my initial research post, and they've supported my work all the way through now to us being awarded a major programme grant. And I think Marie Curie were really ahead of their times. They realised that not everyone was going to be dying from cancer and decided to move more into the diseases that would be affecting all of us in the future, like dementia. So I think they showed great foresight, and I think we really appreciate the support that they've given us over the years.